Steve and I have both been through our own adversities with the NHS. When I was 18, I was in my first term at university. I was in Newcastle. I'd only been there maybe about a month and a half. And I woke up in the middle of the night one day and I was in an immense amount of abdominal pain. Luckily, my parents were visiting at the time. I didn't know what to do. I ended up phoning my dad in the middle of the night, asking him what to do. He's a GP. He's now retired, but he was still a practicing GP at the time, so he was able to advise. He said to monitor the situation and that we'd go to A&E in the morning. We went to A&E the next day and they didn't really diagnose me properly when we went to hospital. They gave me some quite strong pain medication. They gave me pain relief. I had a very uneasy night in the hospital, and then the next day the registrar simply discharged me and with some antibiotics and said, "You've got a UTI." They didn't do any proper tests. There was no diagnostic. They didn't give me a scan. And ultimately, I was still in pain. My parents decided to take it into their own hands and drove me back to our family home in Manchester. And when we got home, I was still doubled over in agony. And my dad really had to use his own contacts and connections as being a GP to get me seen properly. Eventually, I got an ultrasound scan and learned that I had a massive cyst on my ovary. So they got me in for laparoscopic surgery. It turns out that I had a triple ovarian torsion, which essentially means the ovary was twisted round on itself 3 times, and that's the reason why I was in absolute agony. Had it not been for my dad's connections and helping me to actually get diagnosed, I probably would have ended up in a much worse state and I probably would have lost my ovary. Luckily, that didn't happen and it was saved and the surgery was a success. But this is one of the things that's led me towards being so passionate about the medical sector in general and wanting to help people to self-direct their care. Steve's also been through his own misdiagnosis, which is a story for another time, but that had a huge knock-on effect on his life as well.